So what is service design? This brief introduction will try to put the subject into context and provide some examples. Open Change is a service design and innovation company based in Dundee, Scotland. We work with a range of clients, helping them to build capacity in service design and address specific problems and challenges facing their organisations. A number of these clients are based in Dundee itself, and we pulled some examples together to show how service design is building bridges and creating new ways of working in the city. You can download this as a PDF from our website. Our definition of service design is a simple one. It is putting people at the heart of thoughtfully designed activities, processes, and experiences. So how can you do this? What can the trigger be? And how can this affect the day-to-day practices of a team or organisation? Cancer surgeon Rod Mountain works at Ninewells Hospital in Dundee and is an associate of Open Change. Here he explains how service design changes what he does.
Rod Mountain, I'm an ENT surgeon working for the NHS. I'm based up at Ninewells Hospital in Dundee and I've been there for probably the last 20 years. Been in the UK for about 30 years now, and I almost feel Dundonian. I'm part of the team. If you'd asked me 2 years ago, what does design mean in a healthcare setting, I'd probably look at you with a slightly glazed look and think of architecture, maybe buildings. And I think if you even went and Googled healthcare design, that's what you end up with. It's structures, buildings and things. So truly learning what design means, products, services, digital interactive, interiors, exterior, the physical spaces that we work in, suddenly, oh wow, this is powerful stuff. So it's quite an embarrassing moment for me, this realization of what design is sitting having a cup of coffee with Mike and looking at the pressures in the NHS and him saying to me, well, Rod, how do you address all the challenges you have in the NHS? So I went into medical mode, management mode, and said, well, look, we get together as a bunch of senior doctors, a few managers, maybe some senior nurses. We have a meeting. We then we shuffle things around, basically. There's very rarely some radical change that occurs in that. And then there was this sort of pause, and he looked at me and he said, well, Rod, who are your users? So, oh dear. We've completely forgotten about engaging with our users, our patients, our carers, our staff that work in our teams in the hospital. So that one engagement sort of changed my mindset completely, and then I've gone off and tried to learn the language of what design's all about. What I've learnt is I went along to a lot of Mike and Hazel's service design events and actually saw how they structured a service design engagement with a challenge and learnt the tools that they that they use in service design. Empathy mapping, a whole lot of other tools, rip and mix, things that you can actually take and use in a practical sense. And I've taken those tools out and experimented, I suppose, with a classic example would be education. And you'd say, where does design come into education? So we have a new type of cancer that we're all dealing with, that we're all learning about as doctors. It's a throat cancer. And traditionally, we would hold an education get-together where we'd all get somebody to present the latest academic updates on that subject, and we all get together on a Friday afternoon. And it's a bit dry, to be quite honest. You maybe learn a little bit in that way of going about things. But I thought, why don't we set up an event where we would get all our staff that help patients with that condition? In other words, our nursing team, our administrators, some of the cancer chemotherapists, surgeons, but very importantly, bring some patients to that education event. So we had about 30 people in a room, 5 people who had had that cancer and been on that journey with that cancer in the room for half a day. And it was just fantastic. We listened to their stories and the touch points along the way, all these design sort of approaches, and we learned more as a team. The patients learnt a lot about the disease. We learnt so much from them, and we learned things that we'd never have expected, a lot of things.
In short, service design gives you new insights, and those insights enable you to make services easier to use and easier to understand. It makes things work better. In our experience, and based on research we have done, 3 things are needed for service design to have maximum impact. Service design needs effective leadership. Leadership that combines vision with inclusion, that provides a focus and direction for the organisation. For the last 3 years, Open Change Director Hazel White has worked with the Queen's Young Leaders. Every year, 120 potential leaders from across the UK Commonwealth undergo a programme of training and mentorship to help them make positive, progressive changes in their own countries and begin establishing their track records as future leaders. This includes a programme of service design training delivered by Hazel and Glasgow-based service designer Andy Young. Whilst leadership is essential, so is a community of people who can apply, develop and refine the vision for change. That sense of community can be established within a team or organisation, within a city or country, or indeed across the world. In May 2017, Dundee held its first GovJam, a 2-day service design jam for public sector professionals. Over 60 people from local government, health services, education, national government and the voluntary sector worked together, learning and applying service design methods and techniques. They have since gone on to apply this in their own organisations and indeed have worked together to support each other as committed initiators of change. In addition to leadership and community, organisations need to build the capacity to undertake service design for themselves, not simply to buy it in as a consultancy service. This involves training and developing staff in the skills and knowledge of service design. Indeed, this is the very reason we've established the Service Design Academy and its accredited training programme in order to build service design capacity throughout organisations. There are some key methods and approaches that underpin the practice of service design. Perhaps most fundamental is that of putting people at the heart of conversations in order to establish their wants, needs and aspirations. There are many techniques and methods we can apply in user interviews. Perhaps the most important method is how to listen. We don't interview people to solve their problems on the spot. We interview people to listen carefully to their experience of a service and to find out what works and what doesn't. Another approach that's fundamental to good service design is working collaboratively with others, making sure that the design process takes account of different perspectives to ensure that it's inclusive and that ideas are informed by the right experience and expertise. And if we cannot design with our users, then we have to ensure that we've made every effort to walk in their shoes. Design walkabouts, or service safaris as they're sometimes called, involve us going out and experiencing a service for ourselves as a user, to analyse and reflect all aspects of that experience, and to use that when we're designing something new. The author John le Carré has said that a desk is a very dangerous place to view the world. We say that it's an even more dangerous place in which to undertake service design. We always encourage people to step outside, quite literally, to talk to people and to go walkabout, to understand fully design issues from the perspective of people's lived experiences. Throughout all of these methods to understand people, their lives and their experiences, working collaboratively, we can use brainstorming to make sense of our research and insights and to generate new ideas. Of course, we have a range of tools and methods to help us in idea generation, or ideation as it's also known. These enable us to create, explore and visualize alternatives. In doing service design, we must always be aware of where we are in the design process. A useful way of understanding and visualizing design is by using the double diamond model that was developed first by the UK Design Council. This model shows that the design process comprises 4 phases: discover, define, develop and deliver. The diamond form suggests how our thought processes work at each stage in design. In the discover phase, we're thinking broadly, expansively, trying to understand what people are trying to do and what problems they're experiencing. After this, we're narrowing things down to define what the key problem is that we need to solve. Here, we're thinking convergently, analytically, to define a design brief right at the centre of our model. Once we've identified the problem, we need to develop ideas, and again, we're thinking divergently to generate as many ideas as we can so that we can select the most appropriate to take forward. Finally, in the deliver phase, we're focusing down, getting feedback, planning, and analysing how it works. Another way of looking at this is this. In the discover and define phases, we're making sure that we're going to design the right thing. In the develop and deliver phases, we're looking to design the thing right. So what is good service design? Here are a few of our favourite examples. Many of us have used Airbnb to get accommodation when we're travelling on holiday or on business. This company, which has a presence across the world, was only founded in 2008 by 2 design graduates. They've put the emphasis on designing a service that is seamless in terms of the customer experience and the quality provided. Airbnb combines an exceptionally well-considered digital service with real-world services that match that quality and the expectations of their customers. Transport for London provides one of the most complex services in the world. London's transport system integrates a complex network of bus, underground, rail, and even river services. The underground system alone serves 1.5 billion passengers every year. That's why Transport for London and its 29,000 staff place service design at the heart of what they do. They've used mobile and other technologies to make staff more passenger focused, helping people to understand, navigate and use the transport system effectively and overall to transform the passenger experience. The UK's Macmillan nurses support people with cancer, their families and carers. In many cases, they're supporting people through end-of-life care. Their vital services can only work well if they place patients and their families right at their very heart. That's why Macmillan takes design very seriously and has an in-house design team to ensure that patient experiences and needs fully inform what they do and ensure that they innovate their services to keep up with changing needs and challenges. Skills Development Scotland provides career advice, and their My World of Work initiative combines online with face-to-face services tailored to the needs of individuals. Since its introduction, it's been a considerable success, making their service more efficient and far more effective in meeting the needs of ever more school leavers and others to help them navigate opportunities in the fast-moving world of work. A recent personal experience highlighted this great service in Athens. So what do you do if you have to check out of your Airbnb at 10 in the morning but your flight is not until 9 at night? Baggagement is a startup that began only in September 2017 that simply picks up your baggage at one place and drops it off at another place at a specified time. The web interface is clear, very easy to navigate and highly responsive. And George was there bang on 10 a.m. to pick up our bags, which he deposited promptly to us at the airport at 7 that evening. A service that meets a specific need, delivering it effectively, efficiently, and in a very friendly way. Dundee City Council used service design in partnership with us at Open Change in developing the Young Workforce Programme. Their challenge was, how do you improve opportunities for young people in the city in terms of working for council services? We developed a co-design process that puts young people at the heart of focused conversations, enabling their voices to be heard and improved services for them to be developed. As a result of this, over 10 significant changes were made in how the council employs young people and provides them with opportunities for the future. This page links you to our report on the process and the outcomes and a film that was made showing how the event worked. So what is the value of service design? We asked Stephen Kyle, the Transformation Manager at Dundee City Council, with whom we've worked, what he thinks the return on investment has been. Whilst acknowledging the difficulties at this stage of quantifying the return, in his view there have been two major gains. First, moving towards transforming council services for citizens rather than simply saving money. And secondly, service design can reconnect people with what they valued when they first went into work. In other words, an improvement in how people are doing their jobs within local government. As he says, we want to capture the citizen voice more, so it isn't solely focused on the return being about money, performance, etc., but also bringing the citizen experience to life. It'll be interesting, he says, to see how we can do this publicly better using digital storytelling. The final point to make about service design is that it goes way beyond using specific tools, methods and approaches. It's about an attitude and a mindset. The NHS School for Health and Social Care radicals differentiate between two types of people. We're probably all familiar with the troublemaker. The person who complains, is me-focused, is often angry and pessimistic, who saps the energy of those around them, alienating others, fixating on problems, and often being, unsurprisingly, alone in the staff canteen. In service design, we encourage people to adopt the opposite mindset of being a radical, to create rather than complain, to be focused on the mission rather than themselves, to be passionate and optimistic so that they generate energy in others, they attract people to their ideas, they focus on a world of possibilities, and they do this together in collaboration with their colleagues and wider communities. Service design is about radical change, and to do that, you have to have the attitude of a radical. But don't just listen to what we have to say about service design, find out what others say as well. At the Service Design Conference held in 2018, we interviewed a number of prominent service designers to find out how they define service design. And we made a short film that pulls their very different answers together. Take a look at that film and engage in the debate on Twitter and on our Service Design Academy Slack channel.